Good afternoon, everybody. It's John Ross with the XPian Daily News Report for 12/23, just a few days before Christmas here, and we're just so happy to be with you. We're going to have a special guest a little later here. We're going to put up Linnea Windel, President and CEO of the Visiting Nurses Association, VNA Healthcare. And she's going to be talking to us and give us an update about where they're at there. I think you'll be very informed by her being with us. Uh, as you can see, I've started the snow here. We have a little snow coming down. This is technical snow, but get your shovels ready, right? As you can see, I got over my shoulder, we have the Paramount Arts Center, and then the bigger building there is the Leland Tower. We know on top of the Leland we have that Christmas tree with the light, with the starlight at the top. So it's Christmas here in the community in Aurora. In Batavia, we have a Peace on Earth downtown, which I really think is nice that our local barber Craig Foltos got going. I think that's really great. And I just wish you an all Merry Christmas right now. And as Christians, we're happy right now because that Christmas is when God came down with his son, Jesus. And we're so happy about that. And that's what Christmas is about. And so Christians are rejoicing, and we're sharing too. I hope we're all sharing like we can help. And I know Captain Joaquin Rangel at the Salvation Army could use some helps there. Look at the website xpin.news, and you can see some more things where you can help our brothers and sisters there that need help, and they just need help with the kettles there and everything. I was in today's Aurora Beacon about that, and we talked about it too the other day online with him. So you can look more online there. I have it at xpin.news. So without much further ado, we're just going to go right to our interview with CEO President Linnea Windel of VNA Healthcare. And I'm going to bring it up, and we had a little glitch here. I hope you can hear me well on the audio. Excuse that, but I know you can hear her well. So we're going to put it up right now. Let's see what we can do here. Okay, we're going to try to get her going here. Oh, I remember we got to remove the snow here for a second. We'll get the snow right back, though, but. Hello, everybody. It's John Ross here. We're with our XPN Daily Report for 12/21. Oh, hold it. We didn't catch that one. It's 23, folks. Sorry about that one. Yeah, I knew it was 23. I had 21 because that was my other guest 2 days ago. So anyway, it's 12/23 and a few days before Christmas, and we're privileged today to have a special guest. We got Linnea Windel, President and CEO of VNA Healthcare, and it's just a privilege to have her with us here today. And we're going to let Linnea just update us and just talk about what's happening at the VNA. They're very important ingredient to good health here in Aurora and to beat this pandemic. And so, Linnea, I think you wanted to, good to see you again.
Good to see
And
you.
I appreciate you being here. And maybe give us a little first overview of BNA and its history background.
Sure. Well, thanks first of all for having me, John, and it's great to be here talking with you. As many of you know, VNA is a community health center and we've been serving the Aurora area since 1918. We were actually founded in the midst of the flu pandemic of 1918 in December of that year. And so VNA has been serving this area for over 100 years. And today we have a great variety of healthcare and medical services. We have physicians, family practice doctors, obstetricians, pediatricians on staff, podiatry, optometry, and dental services. We have a whole number of services that are provided in the home with medical house calls, a Medicare certified home health service, hospice care in the home. And then we have some additional kinds of programs that have a public health focus, a parenting support program called Healthy Families. We provide nutrition services with the WIC Infant Children Nutrition Program, family case management, which is a public health program. And we are registered with the state as a vaccines for children provider. So getting those vaccines through that system and providing them to children that are eligible in that program. So a number of public health services, home care services, and we are community health center, also known as a federally qualified health center, providing a great deal of primary care for people. And we provide that care whether they have insurance or not. We serve a lot of people who are on Medicaid, a lot of people who pay on a sliding fee discounted schedule, and people with Medicare or private insurance too. But we're really a safety net for the community so that everyone who needs health care can obtain it. And today we serve 72,000 patients with a number of clinics across suburban Chicago area. Aurora's home base, and we have our largest clinic right off of Highland Avenue in Aurora. And then we have a clinic, good-sized clinic that we constructed a few years ago because there was so much need for it over on the east side, over off of Farnsworth. And then we operate a school-based health center at Aurora East High School. So a number of clinics right here in Aurora, and in fact, 30,000 people who live in Aurora, who are Aurora residents, come to VNA for their medical care. And about 10,000 more people from surrounding areas come to our Aurora clinics. And then the other 30,000 or so are coming to clinics that we have in other towns like Carroll Stream, and we have large clinics in Elgin, we have Bensonville, Romeoville, Bolingbrook, Joliet, so a lot of other locations too. But again, Aurora really is our home base, and it's where we started over 100 years ago.
That's great, Linnea. And in the last month since COVID-19, you've had a couple programs, at least I know about.
Yep.
One would be the drive up the testing, the COVID testing. Now, you want to give a little more information on how that's going, COVID-19 testing?
Yeah, sure, would be glad to. So really starting in the early days of the pandemic, way back in March, we started with COVID testing, and we did that with these drive-up clinics. So in Aurora, that's at Highland Avenue, and folks make an appointment, and they drive up essentially to the area that we have set up with tents and a whole setup. It's behind our office on Highland Avenue. It's right off of West Park, and they drive up, and the provider, the nurse practitioner, doctor, talks for a moment with the person on the phone and kind of talks through what's been happening and their symptoms and things like that. And then the test is done, and we send it to the laboratory. And right now they average 2 to 3 days getting it back to us. and then the nurse calls with results. It's what's called a PCR test, so it's highly accurate, and it's certainly been something that over time, we've modified a bit. We now use a nasal swab, so it's a nasal versus, in the early days we were doing nasopharyngeal tests. So it's nasal now, and it's still a PCR test, which again is kind of it's a very accurate test. So to date, we have done almost 24,000 tests. So it's been an activity that we've had a lot of people getting testing from VNA.
Now, if they don't have insurance, it's free.
That's true. There is no charge to the person, and we accept all insurances. And if it's out of network, we're not billing people for these services, for the testing services, and we're not charging copays or deductibles. So there is no out of pocket payment that the person will have for COVID testing and the evaluation that goes with that. Now, the laboratory itself processing the specimen, it's possible, it's not very likely, but it's possible that if the person still has a copay that applies in that situation, there may be, but for VNA's part, there is no out-of-pocket payment.
And they don't have to have symptoms, do they, to have the test?
Yeah, no, they can have there could be symptoms or no symptoms. It's either way is fine.
That's good. Now you have another program about flu shots. How does that work?
It's still going. It's not too late. I still encourage people, if you haven't gotten a flu shot, go ahead and get it. It's just good in general. You want to kind of keep your immunity up, right? So we are still encouraging it. We've done many thousands of flu shots this season, and we will continue with that into the winter, because again, it's not too late to get it. So we still encourage it.
We've got some feedback here now from you, Linnea.
Oh, okay. All right.
Oh, that's better now.
Okay.
It's a little better.
Okay.
Yeah. But you're still doing the flu shots, right?
I'm sorry, could you repeat that?
You're still doing the flu shots?
We still are, yeah. Now we're doing those inside of our clinics now. So you just call and get a time and come on in and get it.
It's coming back again. I hope everybody's catching all these things. The big thing I wanted to ask you, and just at the last days, I tried to have an interview with my Rush Presbyterian, Rush Copley president, who was Aquanian, but he was too busy. He was busy. But I wanted to ask him the same question about the vaccine. How does that look? And when do you anticipate to have public vaccines? And also on the other side, have your people had the vaccines yet?
So actually, perhaps even this week yet, we may receive vaccine in order to immunize the staff who provide direct patient care. So that we're waiting. It could be any day that we receive vaccine in order to immunize those frontline workers that want to be immunized. And then, as you've probably been reading, there are different phases with this based on different populations, and so over time, there will be different groups that get immunized. and that all comes from this the federal group, ACIP, who will provide some recommendations, and then the states kind of go from there and put together their guidance. We'll be following those. We would anticipate general public by spring. So
Maybe in spring, you're saying?
spring.
Okay, I knew it could be a little ways away. I knew after some other things like nursing and front
Yes.
people, I think might be in spring.
Yeah, there'll be some groups within the community, people that are, for instance, involved in food production and utilities and some of those what they call critical infrastructure industries or occupations.
Right.
Yep, and then they'll kind of work their way through those groups and kind of decide the order and subgroups within those groups depending on the vaccine availability.
Okay.
And then the current projection is that by spring, we would be immunizing the general public, and that's very exciting.
And your staff is getting vaccine pretty soon, you think?
Yeah, I think, we heard that we may receive vaccine, this week yet.
Yeah. Well, I hope so. Yeah.
Oh, yeah.
Some nurse friend, some shot from Advocate, and they did so much the Advocate healthcare system. And, of course, they had to go to some hospital a little ways away. That wasn't one of the Advocate hospitals, but because they didn't do it in Aurora. But anyway, they got the shot. My one friend was proudly showing her arm that she got her shot.
Her shot, yeah. Yeah, as you know, the hospitals have started, and it's exciting.
Yeah,
Really
well,
good to
I'm
get
excited you're going to get your shots there because you're right in the front lines there, and you folks need that. So I want everybody to look at the numbers down at the bottom. That's 630-892-4355. Give that a call to set up your COVID test, or also uh, do you have to call in for the flu shot too, or how is that?
the flu shots, yes, at this point, because people will come inside the clinic, it would be by appointment, so just people can just give us a call and
Okay,
we'll set up a flu shot. Yep.
okay. And the COVID testing is outside with the car drive up idea, is that right?
The testing is outside by drive up. It is by appointment, and so you call for that as well, and then
Right.
you drive up.
It's drive up. Okay. I
Yep.
got the difference. One's inside and one's drive up.
Yep.
But you can call that number 630-892-4355 and look at some of the more of the services at dnahealth.com. And I hope some of this didn't get too much to revive, so I'm getting here. So I hope we get the message out. Well, Linnea, we're going to put the message out no matter what. Maybe text only, but we'll get it out. I'm sorry to hear about this little revive. So I think Linnea, she was going to have another guest, but I'll thank Chrissy for helping us out. So we'll thank Chrissy too. Chrissy. So I want to thank Linnea and her friend Chrissy, and I thank Linnea for being with me today. And Lord willing, we'll have something on Christmas Day. It might be a repeat, or we'll see. But we'll have something on Christmas at 5. And so I just want to thank Linnea again for being with us. And we'll work on this. We'll 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 have some more good conversations with Linnea down the road if this doesn't come in good here today. But we'll do our best. And so I wish everybody God. Oh, hey, God, good bless. I'm really not doing good this morning. Well, good bless. God bless. Merry Christmas. And bye-bye, everybody. Bye-bye. Bye-bye.
Happy New Year.
Happy New Year. Amen.
Thank you
Happy New
again.
Year. Feliz Navidad and Nuevo Año. Okay. Bye-bye now.
Bye-bye.